Namaste, everyone, and welcome to this webinar hosted by the American Academy of Yoga and Meditation. My name is Shri. I will be the moderator today. AAYM is a non-profit organization which is dedicated to promoting and spreading the philosophies of yoga around the world. The topic for today's webinar is enhancing the lives of children with autism and ADHD. Millions of children worldwide suffer from chronic illnesses such as autism and ADHD, and these illnesses ruin the lives of the children and their families. Today, we will be learning in depth about what to do when a child has autism or ADHD. We will learn about these important details not only from an allopathic point of view, but also from the yogic point of view. Now, without further delay, please allow me to introduce our esteemed speakers for today. Our first speaker today is Dr. Shivram Varambali. Dr. Varambali is the professor of psychiatry and the head of the Department for Integrative Medicine at NIMHANS in India. He is also an elected member of the National Academy of Medical Sciences in India and has been nominated as vice chairperson of the IPS Task Force on Mind-Body Medicine. Additionally, Dr. Varambali has been awarded the Doctorate in Science in Yoga from S. Vyasa University and has extensive research experience in the field of neurology and psychiatry. He has been the recipient of several awards, including the Dr. Vimla Virmani Award and Dean's Award of 2005 for excellence in teaching. Welcome, Dr. Varambali. Nice to have you here. Our second speaker today is Dr. Arun Solanki. Dr. Solanki is a pediatric neurologist who is privately practicing in Tennessee, USA. He graduated with high honors from his undergraduate university and medical school and did his residency at St. Louis University. He is board certified in child neurology and holds special interest in neurology and epilepsy. Thank you for coming, Dr. Solanki. Once again, thank you all so much for coming, and let us now listen to what our speaker has to say today. Dr. Solanki, namaste all again.
Hi,
namaste. First question is, could you please explain the difference between ADHD, autism, and ADD?
Yeah, sure. Absolutely. And Shri, thank you for having me here today. It's a pleasure to be here with Dr. Varambali as well. I have a slide here made up where I wanted to start talking. Let's start first with ADHD. Okay. When it comes to ADHD, the category of disorder this falls into is a neurodevelopmental disorder. It's often thought of, some people believe that ADHD is a disorder of just children having bad behavior, and that's not necessarily true. It's a disorder of executive functioning, and you can see here that the main area that we see this disorder in is this prefrontal cortex. This is the area that deals with executive functioning, the part of the brain that deals with processing information and planning information. And so when children have ADHD, most people think that these children are very hyperactive, very impulsive. They have a hard time focusing or paying attention. Some people in the past used to differentiate between ADHD and ADD. And so nowadays, recently, everything is pretty much ADHD. And we put certain qualifiers at the end of it. So you can have ADHD combined type, ADHD inattentive type, and ADHD hyperactive type. So the vast majority of individuals fall into this combined type where they have both inattentive symptoms and hyperactive symptoms. Now, the neurobiological front of ADHD is thought to be related to changes in these neural pathways. These pathways are controlled by neurotransmitters, and the three main ones that are seen to be affected in ADHD are with norepinephrine, serotonin, and dopamine. And so we'll talk in the future about how these types of neurotransmitters can be changed or manipulated to try to help with some of the ADHD symptoms. Now, textbook wise, it says it's about 10% of children who have ADHD. I feel like that number is pretty high. Clinically, from what we see of kids, I'd say maybe it's closer to around 7 or 8% of children will probably be diagnosed with ADHD at some time in their life. When it comes to autism, it's important to know that autism is not a single disorder. It's a wide spectrum of clinical presentations, but it falls under a category of pervasive developmental disorders. And so these disorders all have three key characteristics. And one is that there's an impairment in your social skills. There should be some impairment in your language skills, whether that's verbal or nonverbal. And then typically these children show some type of repetitive behavior or restrictive behavior. And we'll go in further details of what part of autism falls into each one of these types of categories. It's suspected to be a polygenetic disorder, meaning there's multiple genes which can sometimes be abnormal that cause these impacts in a child's social development and their communication. There's different types of categories of children with autism. People sometimes used to call high functioning autism as Asperger's, and now we generally tend to call everyone falling on the spectrum as having autism spectrum disorder. But you can have you can have autism requiring mild support, moderate support, or substantial support. And again, we'll talk in the future about what are the differences between these categories. Now, autism is much less prevalent. It's seen in about 1% of children. And those are two of the big key characteristic features or definitions, I should say, of autism and ADHD.
Dr. Solanki, are you on mute?
No, I'd finished with the ADHD and autism definitions.
Okay. Could you please also tell us about the signs and symptoms of these disorders?
Yeah, absolutely. It's really important to kind of know the differences between autism and ADHD because a lot of the times these features can overlap. So when you take a look at some of the signs and symptoms of ADHD, the two big categories are hyperactivity, impulsivity, and inattention. And when it comes to hyperactivity and impulsivity, typically what we see in a lot of children is parents mention that they're fidgeting, they're constantly moving, they have a hard time sitting still for anything. Now, it's important to know that this difficulty in sitting still is not with every task. Some parents will say that my kid can play video games for 2 hours, 3 hours, yet if you tell them to do homework, they can't sit still for 15 minutes. It very much so has to do with a part of the interest on the child's front. These children are oftentimes described as running, climbing when it's inappropriate. They can't play quietly. They're always described as being on the go. Oftentimes they are very interruptive. They can constantly talk, and they do very poor with turn-based activities, such as you try to do a board game, they frequently interrupt or don't wait their turn. And that can sometimes affect the classroom as well. They can blurt out answers or disrupt the classroom when it's inappropriate. There's also a lot of inattentive episodes with ADHD. So for example, they have a hard time paying attention for long periods of time. They have trouble with prolonged tasks. Sometimes it appears that parents feel that they just don't listen to them or that they don't follow through. Parents sometimes come to us saying that they have to repeat what they're saying. They say the same thing over and over. They have to tell them to clean their room multiple times for them to listen. They really tend to avoid things which takes a long time to do. If it can be done maybe in 5 minutes, they'll do it. If it takes longer, usually it falls away. Parents mention that they lose things often, they get distracted very easily, and they're oftentimes forgetful. Now, this issue with memory is typically that of short-term memory. So a young kid could remember hundreds of song lyrics and know the words of songs they heard years ago. But if you ask them what they did in school yesterday, they'll have a hard time remembering. That's the type of difficulty memory we see with ADHD. Typically with ADHD, we can also see some other features. For example, children can have some learning disabilities, they can have some anxiety. Sometimes they can have difficulty with regulating their emotions. And so it's because of this combination that it's often misunderstood as with autism spectrum. Now for autism, the earliest signs that we can typically see is poor social engagement. Parents will sometimes feel that they don't play peekaboo with them, or they're not comforted by their touch. A common thing that we see sometimes is poor eye contact. Speech delay is another common thing that a lot of parents will present with, maybe at around 15 months of age. And that language delay can be, again, with a very wide range. These kids are often described as having concrete thinking. They struggle with empathy. They only think about themselves oftentimes, and they can sometimes struggle with certain types of humor. Parents sometimes feel like they just focus on themselves and ignore the world around them. They have very big difficulty with changes in that routine. You can see repetitive behaviors. And so sometimes these repetitive behaviors are things like rocking back and forth, possibly hitting themselves or hitting others. Even hand flapping can be a soothing, self-stimulatory type behavior. These kids can show sensitivities to their environment. That can be certain types of clothing, textures of clothing, types of food, loud noises, bright lights. Lots of these types of things can affect how they perceive their environment. And then they can have circumscribed interests as well. They can appear obsessed about certain things or preoccupied with certain objects or topics. They must line all their toys up or line all their blocks up, or they're obsessed about a certain TV show that they watch hundreds of times every day. Now, these are a lot of the features of children with autism, but you can have just as a small amount of all of these, or you can have a wide degree, a severe degree of all of these. And so that's why it's important to know that children with autism have a very wide spectrum.
Thank you so much, Dr. Solanki. Dr. Varambali, could you please tell us about the emotional changes? Like what are the emotional changes they go through?
Good morning and good evening to people in the US. Thank you, Dr. Solanki, for giving the basics of the diagnosis and the most of the symptoms as well. Coming to the emotional part, as Dr. Solanki described, the big difficulty with both these categories of disorders is that it's very difficult for the other person to understand what these kids are going through. And in the case of autism, it's extreme degree of inability for the kid to understand what the other person is thinking, especially social, what we call a social cognition or empathy is a big problem for these kids, because they suppose a mother is ill or mother is having pain, the mother may feel very upset that the child doesn't seem to understand it, or get worried about it as a normal person would. And this is not because they don't want to, it's just because they don't really have that ability to understand other people's emotions that well. So that's one of the big problems, and because of that they tend to be typecast as people who don't care. This kid doesn't care, all he cares about is himself, or all she cares about is herself. That's one of the big problems. And they also go through a lot of depression because they get neglected, and it's difficult to play with them, so nobody plays with them, and therefore a lot of these kids end up in depression. And as Dr. Solanki said, many of them also have learning issues, and which may not be recognized because the child doesn't speak up or say these things. On the other hand, the ADHD child would generally make a lot of people frustrated because they think that the child is purposely misbehaving, and that the child often ends up getting punished or not given something, any reinforcement at all, and therefore here it is more a case of frustration, getting upset, throwing things, becoming angry. So they tend to get typecast as bad kids, whereas the autism kids tend to be typecast as indifferent kids, and both are harmful in their own way. The issue really for ADHD, one of the things differentiates the two is that ADHD generally tends to get better with age. And if somebody has a very, very mild ADHD, it may be even okay not to give any pharmacological treatment and wait it out. Whereas autism, that's not the case. You better, start the treatment at the earliest, especially the behavioral form. So the emotional issues come in primarily because these kids don't feel understood, because the other person cannot understand what they're going through, and therefore they either get depressed or frustrated, and this worsens this cycle between the parent or the caregiver and the child.
Thank you. And yes, it is for them, it is so much frustration and anger, which they cannot express well enough that our people like us, we can understand. So it's so difficult for them. But same thing, is it like what about their body? They know they are different. They know how one can understand, how they can, how we can teach them that they are different. How we can do that, Dr. Varambali?
One of the things is that many of these kids are sometimes better in either writing or maybe drawing rather than talking. We expect kids to tell us directly that, look, I'm having pain or I'm feeling frustrated, but kids are not very good with that sometimes. And therefore, if the child is having a better ability to express in terms of the written word or a drawing, in fact, many psychologists use drawing to get the feelings of the child out. So that is one possibility. The second possibility, of course, is many of them are also very good with responding to animated, it may be a video, it may be a cartoon, or they seem to understand these things much better. And of course, this Dr. Solanki did refer to that many people also think that all kids with autism have a special ability, which is highlighted in the Rain Man and movies like that, where it's thought that these people have some special ability. And in fact, otherwise people sometimes say, no, it can't be autism. You should have some special ability with numbers. It's not true. It's a very, very small percentage. But the issue of being understood, you have to explore the particular child's ability to express in different forms: verbal, written, drawing, expression. It may be any of these forms. But if once the child learns that this is how I can express, the child will also make effort. So if you are willing to go halfway to understand the child will also come halfway, and that would be the starting of something which you can work on.
It's like a teamwork between the family, therapist, all around the child. That is so
Exactly.
nice. Dr. Solanki, are there any tools you use to diagnose these disorders? As this can be just learning disability, how one know? So are there any specific tools?
There are. There's a few pretty strict definitions when it comes to diagnosis of ADHD and autism, because exactly like you mentioned, a lot of symptoms can overlap with other things. So, for example, when it comes to the diagnosis of ADHD, typically the criteria is that these children need to be between 6 to 12 years of age for a lot of these hyperactivity and inattentive episodes to first be noticed. And these symptoms can't just be at home and then be perfectly fine at school, or only at school and then do perfectly fine after school. They have to be present in multiple environments, either at home and daycare, school and after sports activities. So it needs to be in multiple environments for this to be considered something like ADHD. Lots of kids can lose things sometimes. Lots of kids can be hyperactive sometimes. But when it comes to ADHD, these features of hyperactivity and impulsivity are there frequently, and they're there constantly, where it impairs their daily functioning, it impairs their daily routine. And so typically these evaluations are performed by psychologists, they can be performed by psychiatrists, and in our case, typically neurologists as well, with the assistance of psychologists. Uh, their primary care providers can sometimes uh, get help with the diagnosis with the psychologist and manage symptoms by themselves. When it comes to actually what they're looking for, it's what we started with mentioning earlier, signs of hyperactivity, inattention. It can look for they look for things such as aggressive behaviors and to assess that aggression separately. It looks at their social functioning, how they adapt to different settings. It looks for any atypical behaviors, for example, rigid, inflexible emotions, as that might be a sign of something else. It looks for anxiety. Kids might be having a hard time at school just because they're dealing with separation anxiety, or there might be some bullying going on at school. Same thing, it looks for physical symptoms. Children could be getting poor sleep at night, and that could be affecting their performance at school. So those are the big parts of the evaluation of children with ADHD. Just like when it comes with autism, age plays a very big role, and it's typically made on average after around 3 years of age. But you definitely see some parents maybe recognizing some symptoms as young as 1, maybe even 15 months of age. If kids are presenting at that young an age, typically we usually do some closer observation. And again, these evaluations are typically performed by psychologists or psychiatrists, or they can assist neurologists or primary care physicians as well in making that diagnosis. When it comes to autism, that evaluation includes how their social interaction is. Are they dealing with any impairments in their speech? Typically, it's important to know that these children with autism, they have difficulties with their expressive speech. Oftentimes, parents mention that they understand a lot more than they can verbally express. They have difficulty in emotional responses, so these evaluations take a look at their emotional responses. It looks at how they cognitively approach tasks. Do they keep doing the same thing over and over again, or are they able to change and adapt? They try to evaluate to see if they have this restricted thought pattern that can oftentimes be seen in children with autism. And of course, some of the most overt symptoms are these repetitive behaviors. Oftentimes, most people know about the hand flapping, but there can be other types of self-soothing stimulatory behavior that these evaluations take a look for. And so these are the big features that we typically look for in children with autism or ADHD.
So, Dr. Solanki, early detection can make a difference?
That is something that we almost always try to purvey to our parents. Early detection is always important, not only for autism, but for ADHD as well. A lot of studies have shown that the earlier interventions that can be made, 1 out of 10 children that were labeled as possible concern for autism, 1 out of 10 children, if they got therapy early enough, that consideration, that diagnosis was removed. So the thought is that maybe about 10% of children, if you get enough intervention, enough therapy at a young enough age, about 10% might show some improvement. And I know that doesn't sound like a large number, but then it's important to know that as these interventions go, therapy, these benefits can just kind of continue and continue. For example, if you get a child early on in speech therapy, it can help with their expression. Their expression can help with anger. Improvements in their anger can help with their interactions with siblings, which can help with school or after school sports or routine. And so these benefits build up on each other. There's also concerns that the longer a child goes without intervention, without a diagnosis, concerns about issues with behavior, mood, emotions, conduct increase. These children are at risk of increased morbidity, meaning injury to themselves, as well as mortality, which is death. These children often don't think twice about their actions. They're very impulsive. So it has been shown that these children are about a 30% increase of morbidity and 40% increase of mortality. And when it comes to treatment with therapy or pharmacotherapy with medication, these numbers are reduced because it helps with overall attention, helps with some of that impulsivity. So early detection can is absolutely essential.
Thank you so much. Because that way, parents can start thinking about if they see any kind of symptoms, then they should start early. That is so
Absolutely.
nice to know. Dr. Varambali, do you think, many times I have heard, but do you think parents delay either because they are fearful, or maybe denial? They are in denial, or maybe they are feeling little family pressure or community pressure. Do you think so?
Yes, there is some factors like that, but in most cases, it is just that unless it is in your face or so evident, most times we assume that things will get better by themselves, and this is a phase of growing. And many people will tell you that and say, no, no, look, you shouldn't pathologize everything in the child. So it's a very, what you say, thin line to being over obsessing about your kids' problems, or on the other hand, missing something like this. So, as Dr. Arun was saying, what is important is if the child is not really able to express either verbally or only expresses through frustration, it is definitely worth getting a evaluation done. After, and the evaluation reveals that it is nothing, what do you lose? It's great. Whereas if it, like he said, if you delay, for example, autism, it's very clear that the longer you delay, the more difficult it becomes for therapy. Uh, and in ADHD, the concern is that the grasp of the child, what the child would have grasped by a certain age, you can never get that age back. I have seen kids who, when we ask, they come at 9 years of age, and then we say, okay, how was he at 4 years of age? And they say, oh, yeah, he was worse actually. And then we say, look, between 4 and 9, what the child should have learned in school, among friends, that you won't get it back. So you can always treat the child at 9, but what happened between 5 and 9 is not going to come back. So I think it's worth getting an evaluation done. Just looking whether, if you get worried, yes, I think you should take professional help. And if the opinion is that it's not a disorder, you can be very happy.
Definitely. Thank you for that. Dr. Srilanki, are there any different treatments, including therapy, medications? Could you please give us some input on that?
Absolutely. There are multiple different types of treatments um, for both of these conditions. It's important that whenever most people think of ADHD, one of the things that they always think of is just medicine. All right. They see a lot of other individuals, they see a lot of other children, teenagers, adults on medication, and they think that that is the only option. But as it goes, medication is oftentimes our last intervention, and typically therapy is what we initially start with. So, for example, when it comes to something such as autism, if we're dealing with speech delays, then speech therapy to try to help with their expressive speech is something that we try. And even if maybe with speech therapy, they might not be able to verbally express their language, sometimes we can give them devices such as a tablet where they can click on something and tell you, I want food or I want milk. So that is a form of expressive speech that can be helped through something like speech therapy. In the same way, if these children have delays in fine motor skills, they have trouble using scissors or trouble using a pen or a spoon and a fork, occupational therapy can help with these types of delays. And one of the biggest concerns for a lot of our patients with ADHD and autism is their behavior. A lot of the challenging behavior, emotional challenges, disruptive behavior that these children can sometimes show. And so that's where behavioral therapy or a specific type of therapy called ABA therapy can really help with a lot of these behavioral challenges. In addition to these, if the children are old enough to be in school, we talk about educational modifications. For example, providing these kids with study guides. Kids with ADHD They get distracted very easily. Providing them with a study guide gives them something to focus on. Simple things such as sitting closer to the teacher helps eliminate some distractions and maintains that attention. You can do things such as extra time for tests, modified tests. Rather than give them all 3 pages of an exam at one time, you can give them 1 page at a time, which helps direct their attention. Rather than just verbal instructions, teachers can incorporate visual, written instructions, and agendas to help children plan. So these are all initially some of the modifications and treatments options that we have for a lot of the kids, but not only for autism, but for ADHD as well. Other environmental modifications that we can try at home. A lot of parents feel that sports, getting their kids active after school, burning off energy can help with ADHD. There's a lot of discussion about decreased sugar. That is something that's up in the air when it comes to how much that helps children with ADHD, but a lot of parents feel that decreasing sugar helps with a lot of hyperactivity. And omega-3 fatty acids is one dietary modification that has been shown to help a lot of children with ADHD, helps with that hyperactivity and helps with that attention and focus. Fixed routines can also help children not only with ADHD, but autism as well. And if these types of interventions fail, they continue to have a hard time at school or with daily routines, then we think of medication to try to help. And so there's typically 3 classes of medications, depending on some of the features of children with ADHD or autism that we can use. Commonly stimulants or non-stimulants, anti-anxiety medication, and even mood stabilizing medication. They all play a role in trying to help manage some of those neurotransmitter abnormalities that we talked about earlier, and trying to help with that focus and attention for a lot of our kids with ADHD.
I mean, such a simple thing, and still we can find out and help them, right?
It's all about putting the time and effort in.
Yes.
Correct. Dr. Varambali, can you explain what are the possible mechanisms by which yoga may actually help these children?
Yeah, like Dr. Solanki was saying, medicine needed or not is a different question, but then therapy is the first line of treatment for both these conditions. And yoga we have been able to show that it was initially thought that, many of these kids can't even do the yoga. You have to make the yoga adapt to them. You can't expect them to, sit and meditate for, 10 minutes like, an adult is expected to do. And therefore, what yoga can do is that, say, for example, there is a kind of yoga called Mandalam yoga, which is kids getting together and making structures, and maintaining that structure. 6 kids together, you make triangles, intertwined triangles, you make square, or you make some structure in which all the kids have to cooperate with each other. And these are the kind of things which are very helpful for kids, particularly with autism, who can get a sense of the other person, who can improve their interaction with people. And on the other hand, for kids with ADHD, you have to be very careful not to do prolonged yoga poses. You should do faster ones, which they can adapt to, and keep changing the pattern, keep them interested. And for example, yoga postures which imitate animals. Lion breathe, tiger breathing, camel breathing. It fires up their imagination, and they are more likely to stick to the yoga program. Very interestingly, the mechanisms what you asked me about, what we have seen is, for example, in autism, one of the difficulties that I said is understanding other person's emotions. And actually, there is a group of neurons in the brain which we call as the mirror neurons. It's a very, interesting observation by Professor Rizzolatti in the 70s and the 80s in monkeys, which brought this to our attention. And these are neurons in the brain which are responsible for learning by mirroring what happens outside. So if I see a person crying, most of us would somewhat feel sad. I may not even know the person. I don't know the reason why the person is crying, especially if it's a child, but something within us makes us sad. How does this happen? Now, this is how empathy, humans and mammals especially have this very well developed. This is because of the brain's ability to learn from others' experience. We need not go through this experience ourselves. So if somebody is hurt, I feel, I can feel that person's hurt, even though I don't have any hurt in my body. So this is very important, this mirror neurons. And we have seen that especially in autism and another disorder called as schizophrenia, these mirror neurons are not as active as in normal people. And yoga seems to help activate these neurons, because yoga is learnt by imitating another person. So we see somebody doing yoga, maybe our teacher, maybe a colleague, and we try to do the same thing. And this is something that maybe improves their ability to. In fact, there is a study from India done by Shanta Radhakrishna, which shows that after yoga, kids are able to imitate even non-yoga things better. Sounds, gestures, things like that. So this improves the ability to imitate and therefore ultimately understand other people. In ADHD, concentration is a major issue. And like I said, there are specific yoga exercises. One, for example, I would say Trataka. There is something called Trataka, which is basically staring at a flame, a natural flame, a candle at a distance of say around 1 meter, and you make it like a challenge for the kid. Okay, how long can you stare at this flame without blinking? So, okay, 20 seconds, 30 seconds, no, my eyes are watering. Okay, you stop. If you do this, the kid tries to do it, and this actually improves their ability to concentrate. So what we are saying essentially is that what is the deficiency in these kids? You can devise yoga programs to address those deficiencies. And that is how yoga seems to help these kids. There are studies now, of course, in ADHD, most of the studies are not from India actually. Most of them are outside the US and other places, which have shown that I think there is a very big study by Mehta et al. In a school in the US. So what they did, they took ninth grade kids and taught them yoga, and asked them to teach 7th grade kids who had this kind of ADHD kind of difficulties. And this continued for a year. And what they showed at the end of 1 year is that not only did the 7th grade kids do better, the 9th grade kids who were teaching these people also did better. Because in order to teach, you have to know, and you have to do it yourself. So they have shown a 1-year follow-up study that these kids' ADHD symptoms improved and their class performance also improved. So there are very good studies to show these kind of effects now.
That's really a very different thing, but it's like kids teach kids.
Yes.
It's like that. It's very nice. You just mentioned about Trataka. So I think in autism and ADHD, focus is a main thing. They cannot focus. So I think Trataka will do so good for them, right? I mean, Trataka can increase their focus. Are
Yes.
there any other things also they can use for concentration, for any kind of focus?
Yes, yes. So Trataka is just one of the examples I gave, but like I said, for the ADHD, a child with ADHD, faster, repeated change of postures, and then breathing, and then everything should be 1 or 2 minutes. You go longer than that, the child is likely to lose focus or get bored. So you do this in a alternating pattern. And as Dr. Solanki said, games, yogic games, or even say, for example, fast games like table tennis, squash, badminton, where there is no pause between the games, is very good for children with ADHD. On the other hand, cricket is the worst game, because the child has to wait, especially if you're a fielder, you just sit and wait, hoping the ball comes to you. So it has to be something which is constantly, the child is involved in. So fast games are very good. And in yoga, there is a specific kind of yoga called Krida Yoga, which basically is a yogic games. So it might be a test of maintaining a posture. It might be something that doing, faster. So there are many kinds of yoga exercises which can help these children.
Very nice. I mean, little things can improve their concentration, and we can help them from beginning.
Yes.
Dr. Solanki, generally parents they fear that if the first child has ADHD or autism, then the next one also will have this kind of symptoms. Can this happen? Can you guide us, please?
Yeah, there's a big focus when it comes to the genetics of ADHD and autism, and it's absolutely true. There is a strong genetic factor for both ADHD and autism. Just to put it into comparison, height, which oftentimes is known as a very strong heritability index, that's about zero point 0.9. It's very high. So height has a very strong inheritance. So in contrast to that, you also have ADHD, which similar to height has an inheritability index of zero point 0.8. Autism is thought to have a heritability index of somewhere around zero point 0.8 to zero point 0.9. So just as strongly as height is inherited, it's thought that similarly things such as ADHD and autism can be inherited as well. And it's not uncommon for us to oftentimes hear parents mentioning, you know what, I think my child has ADHD because a lot of what I'm seeing, I used to witness in myself, or I see a lot in my partner. So that's one of the reasons that parents and families often think that there's a strong genetic component, and they're right. It's also important to know that these are high numbers, but that means that 10 to 20% of cases can still be outside of heritable genetics. And so that's what makes it very difficult because 20% is still a large number. So it's not just one gene, it's not just one mutation that is causing these to occur. It's multiple genes that we're just still trying to figure out and study to better diagnose these children. There's no blood test, there's no brain scan or image that I can do that will certainly tell me, yes, you have ADHD or yes, you have autism. These are very much so clinical diagnoses. One thing that we also have seen is maternal age can play a big factor in children with autism. So it's been shown that mothers over age of 35 years are at an increased risk of having children with autism. And so that's something that's been shown that as you get older and older, the chances of a child with autism only increases.
Very, very detailed things you said. It is so nice to know. I mean, parents has to kind of always alert what is going on around them in children. So, do you think, Dr. Varambali, that yoga can help parents to keep themselves calm and keep balance between their child with ADHD and other children?
Yes, certainly. I mean, if you want your child to do yoga, you better do it yourself. It's very well known that kids really don't do what they're told, they do what they see. And therefore, what you do, yeah, you tell a kid, you do this, you do this, you do this, and most of it they won't do. But if they see you on a daily basis doing something and you yourself feeling happy about it, without your knowing, they will start imitating you. Uh, and especially when you talk about parents, the parents of a kid with either ADHD or autism are under a tremendous amount of stress simply because it is not a problem that they can solve. Most of us as parents, when a problem is brought to my attention, I want to solve it. I want to make the problem go away for the child. But these are not problems that I can make it go away. And that puts a tremendous amount of stress. And most of them end up either having anxiety or depression themselves or sleeplessness. And in fact, in Nimans, for example, we have a specific yoga program for caregivers of either kids with autism, ADHD, or even people with schizophrenia, their brothers, sisters, fathers, mothers. We have a specific yoga program which focuses more on stress relief, and these are yoga programs which are fairly easy. Can be done sitting on a chair. It can be done in your office. It takes around 30 to 35 minutes a day and focuses mainly on allowing you to sort of look at things without becoming excessively reactive. That's what you need to do, because this is a For many of these parents, it's the next 15, 20 years that they have to help the child. So it's very important. I think they can get a lot of benefit from yoga themselves. And if the child also limitates them, it's a bonus.
Uh, that's correct. Dr. Solanki, do you think siblings and family support can help a child to improve faster?
I think it's almost essential that family support has to play a large role. If you're talking about just Indian households in general, these are fairly large compared to other uh, families, and so structure is very important. Sometimes when parents will come in, they say, we are doing everything to get structure, but my parents, grandparents aren't on the same page. So, for example, one thing that I put it in here because I just recently heard, child doesn't like cauliflower. Parents never cook cauliflower. But then when they went over to grandparents' house, they made cauliflower. And so the child had temper tantrums, meltdowns. Grandparents couldn't handle some of the emotional, uh, the crying, the fits that they were throwing. And so that right there, that lack of being on the same page made childcare very difficult. Same thing with older siblings. Some children with autism are very sensitive to loud noises. So it happens to be that parents try to keep things quiet, or they give their child with autism headphones. But then older siblings, they'll just turn the volume up on the TV, which can affect their sibling that might have autism. And so it's important for everyone to be on the same page, for everyone to support each other, because oftentimes when these children have an emotional breakdown or a temper tantrum, oftentimes it can be traced back to a trigger, something that happened that caused these children to be very frustrated. Um, Raising a child already is very time intensive and energy intensive, and so without family support, it only makes things even harder. One of the most challenging things that we oftentimes see is maybe the mother believes that their child has ADHD or autism, but the father doesn't. And so oftentimes the mother herself is burdening with a lot of this, trying to figure out what she can do, how to take care of this child. And so that right there builds a lot of stress and anxiety, not only between caregivers, but it can affect careers and just day-to-day functioning. So everyone being on the same page, everyone kind of understanding the challenges that their child is having, and trying to eliminate some of the emotional triggers is very important.
Thank you for that answer. Dr. Solanki, what do you tell the parents who are just learning through our webinar that their child may have ADHD or autism symptoms? Where can they start? What should they do?
I think already if they're suspecting or if they're hearing some of these features of hyperactivity or some of these features of impulsivity, if they're suspecting some of these features of autism, the first thing they should do is talk to their primary care doctor, their family physician, their pediatrician, because there are certain evaluations through psychologists that can be made to diagnose these at an early age. And I hope one thing that everyone takes away is that the earlier you get these diagnoses made, the better these children do. The better children with autism do, the better children with ADHD do. Not only do these kids do better at school, they do better at home. You reduce the risk of morbidity, you reduce that risk of mortality, and you just increase the overall success of that child by early diagnosis. I hinted on this a little bit earlier, but parents shouldn't need suffer silently. Everyone wants that perfect child. Everyone hopes that their child is happy and healthy. And so when they start to see these types of challenges, they take that as a personal failure, or they can become very sad, very depressed at times. And it's important not to let that emotionally burden themselves. Sometimes they might even think what others might think, or about their child. Your neighbor, the person down the street, isn't going to be raising your child. It's going to be you. And so it's important to get that early intervention, so as to reduce emotional and physical burdens on yourself.
Thank you. Dr. Varambali, suppose parents came to know that they have their child has ADHD or autism. What do you advise about when and where to start yoga therapy once they find out about this diagnosis?
Um, of course, like Dr. Solanki said, the first thing you need to do is get the child evaluated by um, either the pediatrician or the child psychiatrist, if the closest you can get, and gets a test done, and at least get an idea how mild it is, or how is it moderate, is it severe, and start the treatment, whatever the doctor advises. Number one. Now, when you look at yoga, uh, it's important also to know that you see yoga on YouTube, you see it everywhere, and that yoga may or may not be the best one for ADHD and autism. So it requires a little specialized knowledge, and I'm not sure whether that kind of yoga training would be done everywhere. So it's important to find a good place which has done some work on what kind of yoga is useful for these kids. And it would also be important to sort of get the child familiarized to the fact. One of the big advantages with yoga that we see, especially for kids above 8, uh, they can they get a major sense of self control from you doing yoga. Otherwise, any kid with any disorder or diagnosis, it's a constant thing of doctor tells something, psychologist says something, mother says something, father says something, and you are all simply obeying instructions. Some of the kids have told me, look, I'm your servant, you have to do whatever you say. And everybody says I have this disorder and I have to do all these things. Whereas when they do things like yoga, sport, they get a sense of self-control. I am doing something to get myself better is a very powerful driver of action. So even a simple yoga, if they're able to do well and they see themselves doing better and better, it drives them forward and gives them a lot of self-belief. So we would generally recommend yoga after the age of 8. Uh, but if there is a kid, say with 5 or 6, and the yoga therapist feels that the kid is able to grasp what is being said and do it, there's no problem. But as a rule of thumb, around 8 is the age where we start yoga. And very importantly, the yoga therapist is very important. We don't recommend people to start yoga looking at YouTube or any thing, because the therapist has to know what is appropriate for that person. And like I said, half of it is imitating. You learn from seeing the therapist do it, and then you start doing it yourself. So it's very important to find a good therapist.
Thank you. We have a question from Radhika from Bangalore. She's asking us, does a fixed routine help the child?
Yeah, I think Dr. Solanki, would you want to take that?
Yeah, I absolutely agree. When it comes to fixed routines, a lot of people think about fixed routines for children with autism. They feel like these children do much better when there's a plan in place and they know what to expect. There's less chance for something to kind of be provoking or emotionally kind of triggering for a lot of these young children. But this type of planning and routine can also help children with ADHD as well. Every day, sometimes we'll hear parents say that we started a better routine. We started waking up at the same time. We started a sleep routine where we take a bath, where we brush our teeth, and we read a book. And these types of routines help with planning. And the brain loves routine. It wants to know what's going on next. And so for both ADHD and autism, absolutely, routine is one of the first things, and one of the I shouldn't say it's one of the easiest things to do. It takes time, but if you're consistent with it, these children can very much so thrive with good routine.
Thank you for that answer. Our second question from Jenny from New York. She's asking, what role does diet play in the health of these children? Dr. Varambali, could you please guide us?
Yeah, I think Dr. Solanki did mention omega-3 fatty acids, and there is some evidence coming up now. But again, with the diet, many of these children have slight food fats. I don't like this, and somehow we get it into our head that we have to make the child eat other things. You know, our bodies are very, very malleable and flexible, and as long as he's not missing one of the major nutritional categories, nothing serious will happen. There are kids who grow up eating very poor food, and they still are able to sort of be reasonably healthy. So please don't worry excessively about food fads. Allow the child to have some kind of, like Dr. Solanki said, most of these kids like to eat the same thing for some days, and then of course they may change. That's okay. So as long as it's not, there's no protein at all, there's no fat at all, that can't happen. But what has been found fairly recently, it's true for adults as well, that too much carbohydrates, it's not a good thing. Too much sweet sugar can worsen the behavior of these kids, especially younger. The younger the kid, the so-called sugar kick can be seen very prominently in many of these children, that they become extremely hyperactive after a huge soft drink, for example. It may not be very good at all. So encourage them to eat little more protein and maybe a little more fat. So I would say at least 30 to 40% protein, 30% fat, and 30% or less of carbohydrates is a good idea. It need not be exact, but that's something, a general rule of thumb. And of course, the morning and afternoon kids need energy, so they need to eat. The night eating too much may not be a good thing, and especially routine, when Dr. Solanki was talking about sleep, routine is very critical for most of these children. A kind of a pattern before you go into sleep, maybe reading a book, maybe listening to some calming music, whatever the kid likes, is very critical. So the lifestyle is very important for them, uh, and most of them would settle down to that routine. Any routine takes around 3 to 4 weeks to have any chance of settling in. So please be patient. Let the kid find its own routine, what they like, and once they do it, yeah, that should continue.
Thank you. Dr. Solanki, we have next question from Mr. Johnson. He's asking, do you advise that the child's family should get counseling?
When it comes to counseling, for family, the diagnosis of ADHD and certainly the diagnosis of autism can be very jarring. It can be very difficult. Like I mentioned, a lot of the times parents want nothing but the best for their children. And so when parents hear about these diagnoses, it can be very traumatizing. Not only that, can the diagnosis be very traumatizing, but raising a child with autism, raising a child with ADHD, even more so raising a child with untreated autism or untreated ADHD can be even more challenging. It can put emotional burden on a marriage, on interpersonal relationships. It can put burdens physically, just the physical energy needed to constantly maybe chase your child around or to constantly redirect them. So we oftentimes ask parents, how are you doing? How are you doing with a lot of these behaviors? How are you doing? Because if we suspect that we might be seeing some types of anxiety or depression or difficulties in a marriage, then absolutely, a child needs a great and steady, stable house. And so that starts with the parents.
Thank you. Um, do you think a child can grow out of you? I think you did mention, you did answer this question, but still I'll read it. It says, can child grow out of ADHD and autism?
Yeah, Dr. Vermbali did mention about that. It is pretty commonly thought that most children will grow out of ADHD by adolescence. at least 50 to 70%, I would say, is by adolescence. Now, we do see, half of those can have late adolescence, early adulthood, have some ADHD symptoms, but the vast majority of ADHD patients, they do show improvement just with increased maturity. For autism, unfortunately, not so much is the case. Typically, these children will show a lot of these autistic features throughout their life. Now, that doesn't mean that severity that they see at 2 or 3 years of age is always going to be the severity that they see at 12 or 20. With therapy, improvements in their expression, improvements with how they cope with stress or how they cope with challenges, changes in routine, improvements in just coping mechanisms in general can show improvements in autistic features. So although improvements may be seen, a lot of the core features of children with autism, those generally persist throughout life.
Thank you, Dr. Solanki. Dr. Varambali, do you think community can help or support the child and family? I mean, how they can do it?
I think we sort of discussed this when Dr. Solanki was talking about family support. The most important is that the child should be made understand that, yeah, there may be a problem, but that problem is not the only thing in life. Many parents get into this thing of assuming that a child with ADHD, for example, doesn't need other things like a normal child. All it needs is treatment and more focusing on what the child should do. They also need to have fun, do the normal things that any other child does, and this is where the community comes in. So the kid, for example, a common thing is that the parents get worried that, oh, my kid is little disruptive, so I won't call any friends. I won't let the child go outside much. It's a question of reputation of the family and things like that. But you're further compounding the problem of the child. The child has to go out, learn to make friends. Yeah, there might be difficulties, uh, especially if the child has another sibling. That's a very good way of making sure the child has somebody along, with the child when making friends or going out. But please don't restrict the child's normal activities. And this is where the community comes in. The community has to be accepting that some kids do have these kind of difficulties, and as long as there is no major disruption, the child should be allowed to do as far as possible absolutely normal. There is no point reminding the child every 10 minutes that, look, you have this problem, don't do this. That's very frustrating for the child. So the community has to be a little more accepting and accept the problems of the child, but also accept the child along with that.
That's so true. I mean, I think for anything, any family is going through with any negativity, community and family is the first who can help them out. So you
Right.
said very right. That is the best thing to do as a community, we all are there and they can go further and do something better. Thank you. Dr. Solanki, is there any relationship between obesity in parents and ADHD and autism? This is a question from Mr. Gandhi.
Taking a look at the studies, that hasn't been shown, especially when it comes to either ADHD or autism. It's not so much, like I said, most of these are ADHD, autism. These are very strongly genetic factors, genetic abnormalities present at birth, which caused a lot of the features. So a parent's weight at the time of child's birth, I wouldn't say it has any impact on the development of ADHD or autism.
Our next question, it says relationship between too many medications which parents takes and ADHD and autism. Is there anything like that? Any one of you?
I mean, it's a little difficult question. I think I don't know what they mean by too many medications.
I
Uh,
think what they are trying to say that if parents takes medications, different
right.
medications medications, and if that affect child having autism when they are pregnant, especially?
I don't really think so. There's not good evidence to say that. The only thing, of course, is that like Dr. Solanki said, if the parent is on treatment for a psychiatric condition,
Sure.
yeah, I mean the genetics may dictate the appearance of some psychiatric condition. Many of these are interrelated in the child, but there is no specific link between. For example, there was a big, you know belief that some vaccines can lead to autism and things like that, which hasn't really been shown. So it's not that there is a clear link between any medication and the child developing autism. As a rule, of course, we do try and avoid medications in the mother, simply because there are many medications which can lead to childhood anomalies in the kid. But autism and ADHD, I don't think there's any clear evidence at all.
Mhm.
I don't know that Solanki has anything to
Yeah,
add.
the only two prenatal conditions that we've seen, one is illicit drugs, so drug abuse, street drugs, that has shown to have increased correlations. But prescription drugs, like you mentioned, if it's prescription drugs for mental health disorders, that would suggest maybe there's a mental health disorder that runs in the family, which might mean put the child at increased risk for something like ADHD or autism. But the only other prenatal thing that I could think of would be smoking. Smoking increases the risk of IUGR, which is intrauterine growth restriction, smaller size babies. And these smaller size children has shown to have an increased correlation with ADHD. So those are the only two, just off the top of my head, that I could think of, prenatal factors that could contribute to something like ADHD or autism.
Thank you for that. This question is, I think it's really good question. Can ADHD and autism cause other complications in children? I think especially when Dr. Solanki, you were talking about the medications. Do you think it can cause other different complications?
It's not so much that they cause other complications, but just the way these pathways are connected, they affect serotonin, they affect dopamine, they affect norepinephrine, and these neurotransmitters are important with other pathways in the brain as well, pathways that regulate emotions, pathways that regulate mood, memory. So yes, these oftentimes are associated with things such as anxiety. You can see obsessions, compulsions. You can see um, depression. Anxiety. If I didn't mention that earlier, these things are very commonly seen in children with ADHD and autism, and that's thought to be related to the multiple impairments in these neuronal pathways. So it's not so much that ADHD causes mood disorders or autism. It can be an early sign of bipolar disorders or other anxiety or depression, but the same neurotransmitters, the same chemical abnormalities that can cause ADHD and autism are the same types of abnormalities that can also cause these other comorbid conditions as well.
Thank you. This looks like a question and suggestion. Kathy from Pune, she's saying every therapist should have some specialized training, how to have more patience for how to have more patience while dealing with these children. So are there any specialized training they can have, like every therapist should have?
Most psychologists or therapists do have training in handling children with ADHD and autism, simply because these are fairly the bread and butter of their profession, that they're supposed to handle these kind of issues. But if you're asking me about yoga therapists, no, I don't think every yoga therapist would have a specialized knowledge of this, and many of them would have to take up training. And of course, now there are specific courses. For example, at NIMANS, we run a course for people who have yoga qualifications, specifically about mental health problems and what are the yoga practices which may be helpful and what may not be so helpful. But the knowledge of what the kid has would make the therapist, of course, go and brush up or if necessary refer. So I think most people would ultimately be able to handle it, provided you are open with the therapist that you go to. The most important thing is that the therapist needs to know what is the problem, what is happening at the house, what's happening in school, and then they would be able to handle it. Yes.
And kind of keep smiling face, encouraging them, give rewards. This all
Yes.
things will help too, correct?
Yes. Yes.
Dr. Solanki, are there any last suggestions, guidance for our viewers? Any word?
If there's one takeaway point that I hope everyone can leave with, is that if you, while listening, have had any concerns over possible ADHD or autism, is seek that evaluation as early as possible. Early intervention is key. Okay, so the earlier these kids get intervention, the earlier these children can start therapy, uh, environmental modifications, changes in routine. The better these children do, the better as parents you can set these kids up for success.
Dr. Varambali, your last word.
I think I would like to emphasize that a child with ADHD or autism is still a child. Don't forget that in the diagnosis, the child need to get all the experiences that a child should. And ADHD is just one part of life. So is autism. So we should not put the condition. Uh, for example, somebody has diabetes. We say he has diabetes. We don't say he's a diabetic. That becomes, defining the person by the disease. We should not do that. So
Wow.
both these conditions have good therapies available, and the earlier you start, as Dr. Solanki said, the better. So please don't hesitate to get an evaluation done.
Thank you so much. Dr. Solanki, thank you so much for both of you. Thank you so much for this amazing session. Dr. Solanki, thank you. Sharing with us such a deep medical knowledge about ADHD and autism. We learned that some major symptoms of ADHD include not only short term memory problems and difficulty in emotions and management, but more than that, lot more than that. You also told us that early detection is extremely helpful and that we should always go to the doctor if the symptoms matches. Dr. Varambali, you shared that kids with autism go through depression frequently, whereas kids with ADHD get angry very often. You also told us that ADHD may get better later on their life, in their life, but autism will not get better. Thank you for great information, Dr. Solanki and Dr. Varambali. We all have learned a lot about ADHD and autism today, and I hope all the viewers they enjoyed this webinar and they got lot of information. Our next webinar is on the effect of COVID on students' mental health, and it will be live on Sunday, August 29th at 10 a.m. CST and 8:30 p.m. IST. You can visit our AAYM website for more details. Also, I know our viewers, this is a lot to take, lot of information, and maybe you have lot of questions. You can always connect to us. There is a WhatsApp number. Please give your questions. We'll definitely get back to you. I would like to say thank you for attending this webinar, and special thanks to Dr. Varambali and Dr. Solanki for giving such an informative inside knowledge and also guide our parents how to go, where to start, and how to take care of their children. Thank you so much for attending this webinar. Good morning. good afternoon, and good night, all our viewers around the world. See you all very soon. Thank you.